Well, welcome back, everyone. We are joined today by Dr. Mehran Arabpour, cardiologist at Lima Memorial, to talk about CT cardiac calcium score screening. So thanks for joining us today. Well,
good morning, Chris, and thank you for having me.
All right. Well, firstly, tell us what this screening is exactly.
Well, calcium scoring is a simple, non-invasive, cheap test that can be done in order to determine the degree of calcification within the arteries of the heart. And why would that be important? It's important because when there are plaques build up within the artery, they have three more main components. And one would be the cholesterol and fatty plaques, part of the plaque. The second would be fibrin, and the third component would be calcium. So if we can determine the degree of calcification within the arteries, indirectly we could determine how much plaque an individual has within the arteries of the heart.
All right, and who should consider getting a CT calcium score screening?
This is a test that can be utilized in anybody within the age group of 40 to 70. It should be really done in individuals who are mostly either asymptomatic or have kind of a vague symptoms. It is not a test for someone who's already been diagnosed with coronary artery disease, has had a bypass surgery, or perhaps coronary artery stenting. And it's a good, cheap, and quick, non-invasive test to screen individual to find out who is at risk of having coronary artery disease so that it can lead into further workup in order to diagnose it.
All right, and then what kind of things can someone expect during a screening?
They basically arrive. This is a very quick test. The actual imaging process may take probably less than 5 minutes, if even that. It doesn't even require IV. They come in, they lay on a table, the CAT scan images are obtained, and very quickly thereafter, the results are available.
Okay, and then what would be the next steps if the results of the test are maybe concerning?
Very good. That's a very good question. The calcium score is reported in terms of a number, a total number, and then that number is broken down into a specific percentage of it, which applies to a specific arteries of the heart. Those who have a calcium score of 0, they're lucky enough not to probably ever need to have to come and see me. Those who have calcium score below 100, 0 to 100, are considered those with a mild atherosclerotic or plaques within the artery. If the calcium score is between 100 to 400, they are somewhere in a moderate risk. And those with a greater score of a calcium within the coronary arteries are considered to be high risk, and they determine based on their symptoms, based on their subsequent workup, where they would end up basically having to go. All of those with a calcium score greater than 0 would have that indication for risk factor modification, lifestyle change, lowering their cholesterol. So it is a very valuable test, and at the same time extremely simple and inexpensive procedure.
Right. And then how can someone schedule one of those screenings?
This is, again, as easy as it gets. They can either bring that up to their healthcare provider to order that for them. But even easier than that, they can just pick up the phone and call Lima Memorial Radiology. There is no need for any orders from a physician, and they can themselves request to be scheduled for this test through the radiology department at Lima Memorial. And then from that point on, based on the results, they can follow up and decide if they need to see a physician.
All right. Well, doctor, thank you so much for joining us today. We do appreciate it.
Thank you. My pleasure. Have a wonderful day.
Thank you. Don't go away. We have more when we return.